is where things get a little bit more interesting. Sometimes when you have a significant knee injury that as a result of a rotational component that you have, medial instability, you may have some patellar laxity, and you may need to give a little bit of additional support to the patella. So all you do, you notice I just took the non-sticky surface, put it to the back, centered it, and pre-measured it out. And then I lay it out on the table, and I put a slight slit down the center of my elastic tape.
What are you measuring to? Like when you
This.
flip it? Okay, good.
So then you take this, the center of your 3-inch elastic tape, you're going to put it right in the middle aspect of the posterior popliteal fossa. You're going to smooth it in so that it's the center of the tape, there's no wrinkles. Now, what your objective is then I'm going to put a good full tension on this, and I'm going to tear it so the edge, the border, the rip is right on the medial border of the patella. Bring it around, and do the exact same thing on the opposite side.
Would you do that underneath the
Full
light
tension.
blast, or would you?
Answer that question for me. Who asked that?
Me.
Answer it for me.
Doesn't really matter.
What is the most important thing to stabilize? So it could be different on a different patient.
Okay.
If I'm worried about patellar stability, I want this closer to the skin. If it's just kind of something I want to be careful of, I'm going to put it more superficial. Okay? So again, think about when and why. The big mistake most people make is they have the tear clear back here. The tear needs to be right as you applied full tension at the edge of the patellar border.
How would you do that with the tape that we're going to practice on?
This, you're going to just do it with white tape, but on the test you'll actually get to do this with this tape. Okay? So again, you've re-emphasized the Diamodex. So what you're doing with the white tape is you're practicing. You're just laying it on. You're simulating it out. It's just a simulation. It's no different than anything I just showed you. Just bring it to the point at the edge of the patella. You lay it out. Okay? So that's just for your practice, so you're getting the feel of being in the right position on it. I would do 3 patellar stabilizations. So there would be 3 layers. They would pretty much overlap each other. And then the way I would finish it on is I would go right back into my figure of 8, close up those loose ends, and it's done, just like that. Okay? So that's a patellar stabilization technique immediately and laterally. If I just really, one of the things he's shifted on me, you got to be careful that they don't get all torqued out and externally rotate everything. You want them to try to be in as much a normal, neutral anatomical position as you're taping them. Good positions are important. There's also a technique that's called a derotation.